When the COVID-19 pandemic hit our nation, our country understood it would have not only immense and long-lasting physical ramifications, but it would also take a significant toll on people's emotional and mental health. The pandemic and its physical, economic, and social consequences compounded the critical issues of mental health and suicide, further taxing our burdened health system. It also revealed massive gaps in how our country's systems support mental health and suicide prevention. To effectively address these gaps, national partners approached the Action Alliance, the nation's public-private partnership for suicide prevention, to harness its convening power during this watershed moment. The Action Alliance answered the call by launching the Mental Health and Suicide Prevention National Response to COVID-19, unifying its partners around a common vision to help our country emerge stronger and more resilient. It quickly galvanized influential leaders from nonprofits, federal agencies, large employers, and corporations to address the urgent and long-term needs related to mental health and suicide prevention. To achieve these critical goals, National Response Partners developed an actionable roadmap for building a comprehensive, cohesive, and equitable response to promote mental well-being and save lives. While the pandemic's true impact on mental health and suicidal behavior is still unfolding, the ripple effects are undeniable. That's why the work must not stop here. As the pandemic continues to evolve, so do the mental health and suicide prevention needs of our nation. The solutions identified by the national response require continued collaborative action, because only together can we create a healthier, more resilient country for today, tomorrow, and decades to come. Visit the nationalmentalhealthresponse.org and be part of this collective effort.